There has never been a better time to be a patient with cardiovascular disease. The technological advancements and innovations save lives and improve quality of life.
Wow, fantastic. I miss that loud heart murmur you used to have.
I did too.
Radiation exposure is cumulative. In other words, if you catch a cold, you get the cold and it goes away. Radiation exposure doesn't go away. The radiation exposure that I had 30 years ago is still with me. The radiation exposure that I had 30 minutes ago is added on to the exposure I had 3 decades ago. And so the consequences of radiation exposure, whether it's to the bone marrow, to the brain, orthopedic injury, it's additive. It adds up over time. Forgotten in all of this is the welfare of the nurses and the patient care techs who perform these procedures with the physicians all day long. One of my earliest mentors was a great physician named Dr. Ted Dietrich. Ted Dietrich, there are a handful of people in the world who changed cardiovascular medicine, changed patient care to the degree that Dr. Dietrich did.
I'd had this carotid endarterectomy 6 years before, and I thought that it must be related to a recurrence of the carotid. So when the person picked me up and said, "Where do you want to go? Do you want to go back to the heart hospital where they took the carotid out?" I said, "No, I want to go to Barrows because I think I'm having a stroke." And it turned out I didn't have the stroke, I had a brain tumor.
As innovative as Dr. Dietrich was, as immortal as Dr. Dietrich seemed to be, he probably died of the consequences of radiation exposure. We have not put adequate emphasis on staff safety, physician safety, nursing safety in the cardiac catheterization laboratory. That has been largely ignored. I've been performing cath lab procedures for over 30 years, and I've done well in excess of 10,000 procedures.
It's not a CTO, it's certainly a CSL.
So you definitely have nodular calcium there.
Family is the center of my life. We have 4 children, 4 daughters, who are the love of my life and the reason that I get up in the morning and go to work. They are absolutely everything to me.
You're like the only man I know who's literally surrounded by all women.
When you think about family, this all of a sudden becomes very real, and there's a certain vulnerability that you begin to feel. The adverse consequences of radiation exposure really consumes me.
And over the last 4 decades, and especially over the last 10 years, there have been equipment enhancements to promote safety and reduce injury to college athletes. Very necessary. However, in the most advanced field of medical science, over that same time frame, little has changed in the lab to reduce occupational health hazards.
By the time you've been in the cardiac catheterization laboratory for 20 years, and many of us have, you've had the equivalent of 20,000 chest x-rays to the head and neck. That's an astounding